Hey guys, just gonna start documenting stuff for whatever this turns out to be. I have been having weird things over the past like 3 or 4 weeks. Right now it is Friday, July 28th, 7 a.m. Getting ready to stream, but I don't know if I'm going to. It's hard to feel like crap and then hit a switch and act like nothing's wrong on stream. I don't even know where to start. I guess like 4 weeks ago, I had like pain right here. Still have it, but I can't feel anything. It just kind of felt like muscle tightness, like I lifted my kids too much or something like that. And like just kind of like pulled the muscle like right in my armpit, which I've had before. It feels like, for somebody who's had children, like when your milk ducts get clogged, but like to the touch with my fingers it doesn't feel like that, but like internally it feels like that. It started kind of like coming down into this area. There's not a whole lot going on here, guys, but it's going down into that area. I'm not gifted in that department, which is fine. I don't care. It's going down into there and it feels like the same thing, like a clogged milk duct or a mastitis type thing. And it just kind of stayed like that for like a week or two. So I called my OB to get in, and I'm still haven't seen them. I'm supposed to go next week. But now it's been like 3 weeks. My collarbone area right here is hurting. Up here is hurting, and then behind my ear. And my ear for this whole time has felt like it has had a really bad ear infection. It feels like swollen, it hurts, it feels like an ear infection. I have an otoscope. It looks entirely fine. It doesn't look like there's anything. And my tonsils are always swollen, always. It's not like there's a time where they're not. Like I should have had my tonsils and adenoids out as a kid, and it never happened. My parents weren't told to do it. It's not my parents' fault. It's just one of those things that like the doctors should have been like, those need to come out. But I still have them. They're there. And they're always big. So, yeah, I don't know. I've been getting headaches on the top of my head. I get migraines. I've been getting headaches, but the past 2 days they've been coming down the side of my face to about right here and wrapping around under my eye. And I am having extreme fatigue. Now, you guys know I don't sleep in the first place. I've got sleeping disorders. I don't sleep in the first place. My kids don't let me sleep. I don't sleep. But recently it's been either like under an hour, or if I get more than that, like 1, 2, 3 hours, I'm not hitting REM sleep. I'm not hitting any good like core sleeps. It's just like snoozing, nap time, like not quality sleep. And I am waking up with like hot flashes and night sweats. It's not to the point where like I'm drenching myself in sweat. I'm not a sweaty person. I don't sweat a lot unless I am in like extreme heat and doing like my marathons. If I'm running a marathon, I'll sweat a lot because it's 26 miles. But I'm waking up very uncomfortable. I'm also having heart palpitations. Forgot about that, but one just happened. And they are like, right now it feels fine, but then all of a sudden it's like it skips a beat and it takes the breath out of you. Like it stops and you get super dizzy, and then all of a sudden it kicks back and it's like a punch in your chest. Sometimes that's happening 3, 4, 5 times in a row. I don't know. I'm just documenting right now because I don't know what's happening. And I want to be able to come back and look at this because there is a lot of medical gaslighting that happens in this area around here. And in case this is really bad, these are my symptoms. And I'm gonna have to advocate for myself if this doesn't get better. So that's where we're at right now. I'll keep you guys updated. I've considered back and forth going to the emergency room. I just really don't want to have to. But we'll see. See what happens. I feel like crap. And I don't know why. I'm back with a slight update. So after I recorded that, I decided to go in to see my primary care physician, who still wants my OB to check out everything going on here. So decided not to touch that portion of it, even though that is my main concern. That and my ear does look clear still. So I don't know what is causing my ear to have so much pain. Like, it feels like my eardrum is going to burst. He said it could be something with the tubes not being able to like clog and unclog, and like, even if I can get my ears to unclog, it still hurts. So I don't know if it's something with that or not. However, he listened to my heart and he did not like what that sounded like. I have a soft heart murmur, but I've been having a lot of palpitations and irregular beats. I went for an ECG, and I'm going to be wearing a Holter monitor and also getting like an ultrasound of my heart, essentially. The ECG did not come back yet. It's been like 4 hours or so. I don't have the results for that yet. However, the nurse looked at it and went, okay, well, we're going to send this out to the doctor and he'll call you with the results. Have a good day. And that's where I'm at. So still nothing. I mean, this doctor did. He looked at all my blood work from before. All my blood work was like fine, but this is from like months ago, so you never know how that's going to change. Didn't send me for anything new. I think just because my OB is already kind of like on it, and we already have that scheduled, that he just wants her to do a lot of that work, since, you know, really this whole area here is a lot of the problem. But now this ear is starting to hurt and this armpit is starting to hurt. So I don't know. You guys will probably know before me, figuratively, because you're going to know by the title of this what's happening. Or you can fast forward to the end, so you're not going to wait in agony like me. But this is where I'm at. I don't know what's going on. I'm really tired. I have a really, really bad headache. It's my whole head. It's going down the side of my face. This portion right here feels like heavy. Like, it feels like just heavy. So I don't know. I've been laying off the coffee just in case. So anyway, I don't know. Just keep talking. I'm rambling, but it's because there's going to be somebody out there who's going through a similar thing. And if only one person watches this video, one person, and it helps that one person, that is the goal. That's why I'm doing this. I'm tired. I'm really tired. I just want to go back to bed. It's only 3 o'clock. 3:02. So long to go. Okay. Just keep pushing forward. Mom can't quit. Yeah. All right, you guys. It is another day now. Today is Monday. I got my results back from the test that they did right after my doctor's appointment. He was really concerned about my heart more so than anything. And then I'm going to the OB today to do the exam on everything here. We didn't really get anywhere with any of the other stuff, but he didn't like that I had like this weird sounding heart murmur, which I knew that I had that heart murmur. But anyway, okay, so the test results came back saying enlarged left something. Left something or another was enlarged. I don't know. Anyway, I'm going to be going to get an ultrasound of my heart done, an echocardiogram, and I'm going to be put in a Holter monitor for 48 hours. 48 hours. I'm having a lot of heart palpitations, like where it's like sucking the breath out of me. Like my heart like stops and it's like the breath is like out, and then it's like I get punched in the chest.
and then it's like everything's back again. You get like dizzy and lightheaded and all kinds of stuff. It's almost like you're floating and you're not there. I knew I was having those things too, so I'll do the Holter monitor, but I started noticing like elevated heart rate. For example, I had a resting heart rate of like, I think it was 77. I got in the car, driven down the street to the pizza place, went inside to pick up the pizza place. My heart rate in the car that it recorded prior to going into the pizza place was 77. When I picked up the pizza and got back to my car, which was literally like, I don't know, 10 feet away from my car, my heart rate had elevated to 171. Okay. Today I'm going in to the OB to check everything. I haven't really found like lumps unless like this area here is not normal. I don't know how to say. Inverted, not normal. So I haven't really like felt anything except for like a few little things. But I don't know if it's because of the invertedness of that, but that's where we're at. So going to the OB today. Keep you guys updated. I am at the OB's office now, so we're gonna go in. My appointment's still not for like another 20 minutes, so I'm kind of early. Everything's still causing problems. I was actually, while I was driving here, was hurting pretty bad. And I think other than that, like I think I've updated you guys up until this point so far as to what everything is. So we're gonna go in here and see what they say. Probably a lot of people watching this, if you think you have the same symptoms as whatever this ends up being, if you're like me, you're worried about medical gaslighting. Now, all my doctors have been really good. You know, they want to check everything, but at the same time, it's like, you're worried about people being like, oh, your symptoms aren't that bad, or oh, you're too young to be sick, or whatever. And I know that my doctors are good, but at the same time, like, I don't know what I should be asking for. I want to advocate for myself, but at the same time, if they recommend something or say something that I don't agree with, I don't even know how to disagree with it because I don't know that I disagree. That doesn't make sense, but you know, like, I don't want to automatically assume the worst for myself, but at the same time, it's like, you want to make sure that it's not the worst. So it's like, well, yeah, maybe you don't think I need to get this test run or that scan run or whatever. Like, can we just do it anyways, just to like rule out like the worst possible outcomes of this? Like, if I just have a strained muscle, then I have a strained muscle. If it's more than that, I want to know. Like, I don't want to be sent home on antibiotics and then have to come back and find out that I'm really, really sick or something else is going on. So I just want to make sure that we like pinpoint the right thing. So it stresses me out going in here because I just, you know, I worry that people think that you're a hypochondriac or you're being dramatic or whatever. And I'm not, but people will think that. Alrighty guys, it is now Friday. Oh my gosh, these nails. Kaylee picked out my nail color. We did our nails this morning, so sorry. They're really bright. It's not, I usually do neutral colors, so that throws me off. Anyway, I don't know the last time I updated you guys, probably Monday when I went into the OB's office. So my OB doctor, she's freaking fantastic, like seriously fantastic. I want to send her flowers or something because she's awesome. She is one of those doctors that listens. She is going to look at every single concern you have, make sure everything gets solved. Love her. She's amazing. So she referred me out to get an ultrasound. So y'all know this is a health vlog, so there's no TMI in a health vlog. My breast tissue is really, 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 really dense. So even like with her doing like an exam, she literally can't feel or do anything because it's so dense, which makes me really not a candidate for a mammogram. So on a mammogram, any of that dense tissue shows up white, but any like cysts or cancers or anything like that also show up white. So the whole thing would just be white and we wouldn't be able to see anything. So the other option is to do an ultrasound, which can present similar issues as a mammogram, but it's still much, much easier to detect any type of issues. So she scheduled me for that. I got tired of waiting for scheduling to call me, so I called them, as to which then I got somebody who could only schedule in certain areas here and certain areas there, but couldn't schedule for like everything within this medical district basically. So the only thing she could find was until like the beginning of September, which right now it's like August. I don't know, something. Second, third. the beginning of August. So it was going to be like a whole month away. So I was like, oh my gosh, I'm going to do that. So I called back and I got somebody else who could schedule for a place that's 2 hours from here, but today, which is only 5 days or 4 days since getting the referral. So I was like, I'm going to do that because I just need to get this done and over with, make sure nothing's wrong. However, I am hurting very, very bad. So I don't know what's going to come of this, but we're getting ready to do that 2-hour drive now. Well, that one didn't go as planned. That was the one that I was worrying about. Is when you get there, I walked through the door and I said, yeah, I'm here to have an ultrasound for a breast cancer screening. And they go, are you sure you're not here for a pregnancy ultrasound? And I'm like, no, I told you exactly why I'm here. They're like, well, you're too young for that. Like that, and that's exactly what I was fearing was going to happen. So they didn't do what my doctor had asked. My doctor wanted a bilateral ultrasound of both sides and my arms, my armpits, my arms and everything, my lymph nodes and stuff. And they said, we're not doing that. We're going to do a full mammogram. I said, okay, well, my insurance won't pay for a mammogram unless I have an ultrasound because I'm under 40. So anyway, they said they were doing the mammogram, and I let them know, like, my insurance is not going to pay for that. They're going to fight it. It was requested as an ultrasound because that's how my insurance does it. And I'm, that age. And they're like, well, the procedure here is we're doing a mammogram first and then we'll do the ultrasound. So I was like, whatever, I'm just going to have to deal with that later and fight that or do whatever I've got to do for that. So they did the mammogram, and we knew that they weren't going to be able to see anything on the mammogram because I'm so dense. It's like trying to find a mini marshmallow in the middle of a blizzard. It's not going to happen. So they came back, they're like, that looks fine. We'll go ahead and just do the ultrasound on just the spot that hurts. And I'm like, that's not what my doctor ordered. My doctor wants a full ultrasound of everything on both sides because of the density issue. Well, we're just going to do that one part. So I'm like, great. And they do it and they like go over it with the wand like 2 or 3 times and take the pictures. And she finishes and she said, okay, I'm going to go show this to the radiologist. I'll be back in 10 to 20 minutes. And she walked out the door and I stood up to get my phone, which was on the other side of the room, to text my husband that it was done. And I didn't even make it to the other side of the room before she turned around and came back in and said, all clear, you can go home. I'm like, nobody read, like, I know nobody looked at that one. Nobody read that. Like, there's no way. Like, the radiologist wasn't just standing outside the door. Like, I swear, she just walked out and turned around and came right back in. Like, I didn't even have time to stand up and get my phone before she came back, walking across the other side of the room. The radiologist did not look at that. So I don't know what I'm going to do now. I'm going to be going back to my OB with those reports and see what we have to do from there. I don't know. I'm assuming the next step is an MRI. It's great if there's nothing there, but why am I hurting? Like, I would rather not have anything be there, but I also need a solution as to why I'm in pain. So, but yeah, this one was the one that I was worried about with how they run around and they just, the medical gaslighting that there it was. And I knew it was going to come. I knew it wasn't going to be for my OB. I knew it was going to be after my OB. So, yeah. We'll see what the next step is. Hey guys, it's been a really long time since I've updated you guys on anything health-wise, and that's just because I'm kind of at a standstill. After the ultrasound where they kind of blew everything off, my OB was like, I can't really do anything about them not reading it or whatever. He signed off that it was clear, and that's what I have to go with. So I'm like, cool. She said that we could do further testing, but most likely my insurance wouldn't pay for it, blah, blah, blah. So anyway, it's been a couple weeks, and I've been waiting it out because my family doctor sent me for an echocardiogram and a Holter monitor, and that is what I'm doing today. I'm going to go get all of that done. So first is an echocardiogram. I think I have to get like an IV and they pump like radioactive crap into you and kind of look at your heart with that stuff in it. So that sounds absolutely fabulous. I cannot wait. You have no idea how excited I am for that. And then after that, like 2 hours later, I'm getting hooked up with a Holter monitor that said 48-hour Holter monitor, but online it says 24-hour Holter monitor. I don't know what I'm going to be hooked up with in the end. I have no idea. Nobody seems to really like care. Like, I know everybody's like, oh, they care. It's like, but do they care? Like, I know like they have to like care to a certain extent, but like I just keep getting blown off by everything. And just a couple days ago, we actually were denied service with Kaylee at my doctor's office because she didn't want to have her blood pressure taken and her temperature done and stuff like that. So the doctor was like, not going to see her, not even going to try, and basically just said, they're going to check us out, we're going to leave. So that was fun. So yeah, we're not having a lot of success with any of this. Yeah, I'm still in all my pain and everything that I was before. So that's where we're at. I don't know what else to do other than just keep trucking along. So let's go get the echocardiogram. So I'm back. This was not the doctor's appointment that I thought was going to cause problems. For those of you that know me or that I've been talking to through this process before this video has been updated, like all these months, you know, I've been like blissfully positive throughout all of this. Like, you know, I got all these problems, but nobody's told me I'm dying yet, you know. Nobody's told me I'm dying. Anyway, so echocardiogram. You guys can see I'm hooked up to the Holter monitor. Echocardiogram. Yeah, I have a hole in my heart. They thought that it was like one that didn't close, which happens a lot. Like before you're born, it should close. But that is like of a certain size. Anything bigger than 6 millimeters, I think they said, could be considered an aneurysm. They didn't measure it until the very end, and they were like, could be an aneurysm. So I'm waiting for the cardiologist to call. I haven't. They asked me if I've like had strokes. They're like, have you like suffered and recovered from strokes before? And I'm like, I don't think so. I mean, I have not been diagnosed with a stroke. They do run in my family. But to my knowledge, I have not had a stroke. But then my mom was like, have you had any like really severe chest pain? And I said, no, the only thing I've ever had was when I was in college and we thought I was having an esophageal spasm that mimics a heart attack, like the pain of a heart attack. So, anyway, waiting for the call from the cardiologist. That's it so far. Hey guys, it's been a little while. I think I'm wearing the same outfit as I was in the previous update, but it's been 2 weeks, I think, or so since I've had the Holter monitor and everything. I think the last thing I told you guys that we found out that I have a hole in my heart, and then we were waiting on the results to see if I had an aneurysm. The results are in. I do have an aneurysm in my heart. I am scheduled 2 days from when I'm making this video to go to a cardiologist right now. Seeming like I might have to have that closed surgically. And I think I'm going to be evaluated for POTS. So that's kind of where we're at now. The Holter monitor showed that I had like PVCs and all kinds of stuff, like heart palpitations, things like that. And that I had a migraine pretty much the whole time I had that on. So I was laying down pretty much the whole time. I wasn't like up doing things, but I was still in tachycardia for like 11 or 12% of my day, which is kind of unusual considering I literally did nothing. If you don't know what tachycardia is, it is when your heart rate is abnormally like above 100 beats, 100 beats per minute. So 11 or like 12-ish% of my day was that, even though I was doing pretty much absolutely nothing. So, we're going to see. I also had the opposite of that, bradycardia, which was 16% of my day, which is where my heartbeat was too low. So, that was like in the 50 beat per minute range. So, there's like a 50 beat discrepancy between my high and my low. Yeah, so I'll be back to update you guys after the cardiologist. See, fingers crossed. Hopefully that goes okay, because I was in the middle of training for a marathon when all of this happened, and now I'm pretty sure I'm not gonna be allowed to run my marathon. So we'll see. Alright guys, it has come to the day where I have gone to the cardiologist. He was nice and everything, but there's been a couple things coming up, and I may have mentioned the last video update that I did. One of the things that everybody is throwing at me is the possibility of this being POTS. And as soon as that came into the mix, I'm like, I can't wait for that battle, because if you know a lot about POTS or anything like that, you know it's a battle to try to get somebody to help you with that. Not all doctors are familiar with it. Some doctors just flat out think you're just making crap up and they won't even acknowledge it and whatnot. So I have had a lot, pretty much textbook actually, POTS. I didn't know a whole lot about it until it started getting thrown around there. And then I was looking into it and I was like, cool, maybe that. So I went into the cardiologist and I said, I got this hole in my heart, I got this aneurysm in my heart, and it's been mentioned to me that I should be evaluated for POTS, and you have to have that done through a cardiologist or a neurologist. We didn't even get into anything. He just asked me what brought me here, and he looked at me and goes, you don't have POTS. We're not testing for POTS. I'm like, cool, thanks. Great. I'm just sick of having symptoms and just the medical system failing me and nobody caring, basically. It's like, I mean, your doctors care enough to keep you alive kind of thing, but it's like, I'm in pain, I'm having these symptoms, my everyday life is difficult, I'm tired, I'm dizzy, my chest hurts, I'm short of breath, I have migraines every single day of my life. Like, I've got all these things, I'm not dead, so you don't have to treat me like I'm dying, but I need relief for my symptoms. And when I have those concerns, it's your job to take and listen to those symptoms and come up with a plan to try to mitigate, reduce those symptoms, right? And at this point, I'm just to the point where it's like, you say all these symptoms and everybody's like, good luck. Like, or they pass you to another doctor who says, I'm not going to help you. And then they pass you to another doctor. I'm not going to help you. They pass you to another. So now I'm irritated. But anyway, the heart problem, he's saying he doesn't think I have to have surgery or close it or it's any type of aneurysm that can rupture and cause problems. However, they are going to do an internal esophageal echocardiogram, which is where they stick like an ultrasound wand, essentially. Like it's not like the wand, but little down your esophagus, and they do the echocardiogram, which is an ultrasound from the inside of your body versus the outside of your body. So you are sedated and all that stuff for that. So I'm waiting for scheduling to call back on that. He just wants to make sure that it's just what he thinks it is and not something else. So anyway, on top of that, we've ordered some blood work. So I have got a complete blood count, CBC. I have got ProTime IRN, which is like a blood clotting component, chemical component makeup of your, I don't know, something to do with blood clotting. I've got magnesium, which I guarantee is probably pretty low. I've got HCG. Dear Lord, please don't let that come back high, because woo, I don't need a fourth child. And I've got comprehensive metabolic panel. I am headed out to do those now, so I'll let you know. And in the meantime, I have contacted my PCP, primary care physician. He does want to get a second opinion. I mentioned the whole POTS thing again, that he blew it off. So I'm just waiting to hear back about that. The only other thing is, you guys know my friend Alexis. She mentioned to me to call my doctor and say I discussed POTS. I asked for an evaluation for POTS. Doctor declined to do the evaluation. Please note that on my chart so that if this comes back as POTS, I'm coming for you, essentially. So yeah, we're gonna do that. So on my way to get the blood work. Let's go. Quick update. Didn't die. That's good. One more thing down in this whole process. I'll update you guys whenever the next thing happens. I don't know. Yes, my kids are listening to Thriller in the background, and we've got homeschool crap all over the table. But anyway, thought I'd give you guys a little bit of an update here. So I've been going back and forth with my primary care physician and one-sided conversation with the cardiologist. Anyways, it's been 9 days since I sent my cardiologist a message saying, here's my heart rate spiking from 62 or whatever, 64, the whole way up to 135 when I stand up. It's a 2-minute long video and it stays elevated for the whole 2 minutes. For anybody who's out there who's like, in order to get diagnosed, you have to, are we going out? What are we doing? You going out? Go. Go. Your heart rate has to stay sustained at that level. Right now, the national standards are that it has to stay sustained for 30 seconds. I showed a whole 2.5-minute video of it being that high. So anyway, 9 days since then, the cardiologist has not responded. I have called in. The nurse, when it got there, marked it as high priority, which means that they have to respond to it within 24 hours of it being marked as high priority. I didn't ask for that. Like when I called in the first time, they're like, oh yeah, we see the nurse marked it as high priority. Cool, because it kind of is. I'm not dying, but like I need an answer, right? So I'm like out of breath. Like I literally just stood up and walked to the door, let the dog out and sit down. I am out of breath. I don't even know what my heart rate is right now. We can figure it out though. So what was I saying? This is the thing with it. Your heart rate goes up, you feel like crap, and then you have brain fog and you forget everything. What's that? 70 right now. Okay. Anyway, I've been going not back and forth. I sent in all the information. I've called like every single day asking for an update. He's been in the office, but he's not responding to it. So I don't know about the cardiologist at this point, but my PCP, I messaged the day that I got out of cardiology and I was like, listen, he didn't run the test that I wanted to be run. I really would feel comfortable having these tests run. Even if it turns out that the cardiologist is right and I don't have it, I've got all the symptoms. I've got the heart rate issue, right? I've got the heart rate issue. And I have all these symptoms. I would really appreciate if something could be done about it. But I also have migraines that are linked to this, that could be linked to this. I still have this chronic ear pain. I've had this chronic eye pain that they thought I was going to get needle therapy in my retinas because they thought my eye pain was so bad that they thought I was going to have like retina surgery. Everything was fine. Everything was fine. I've gone through sleep studies. I've gone through literally everything except neurology. And for somebody who has migraines, probably should see neurology, right? So anyway, I spent all that time calling around to different neurologists in the area. The one here that doesn't really specialize in what I need, saying. The one that specializes in what I need not even specializes, like could help, could order the test that I need. Let's put it that way. Doesn't really even specialize, could order the test. There's only one in my area that can do that. And he's not taking patients until the end of March, until the beginning of April. At the time I'm recording it, it is September. So just to give you an idea. So anyway, I called Penn State Hershey, which is like an hour and a half, 2 hours away from me. Penn State Hershey Neurology, they have a huge neurological center facility, whatever it is. I don't know. This thing isn't even working because I keep moving my fingers around. They've got all kinds of different stuff. So I called them. I was like, listen, I don't need a referral. Can you just take me? And they're like, well, we have to be able to see your files first so that we can figure out what doctor to place you with. And if you have enough symptoms, we put you straight into the POTS facility. If you don't, then we'll run all the tests with a certain doctor and then they'll drop you into that facility later on. What am I at here? I'm at 100. That's tachycardia right there. So anyway, it's been 9 days. I called this morning, called every single day, and he finally last night just sent the referral in to Hershey, which, what? Open the door then. You're fine. Anyway, they're scheduling like 8 weeks out, I think, once they finally get my information. So I'm probably looking at the end of November, but that is better than April. So, this has been a 5-minute video. I'm sorry, guys. All right, guys, it's been 12 days since my initial message at the cardiology about begging them to send me for a POTS eval. He called back and was like, nope, not gonna do it. I'm so sure you don't have it, we're not gonna do it. And his definition of POTS, no, he went to school, blah, 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 but his definition of POTS is not what POTS is. So he doesn't understand what POTS is enough to send me for the testing, because I literally sent these standards for diagnosing it and all of my symptoms explaining that I fall within all of that and my heart rate within the guidelines of POTS. And he said, no, you don't have it. Even with the national standards for diagnosing. I don't know if he just didn't read them or what, but I don't know. So now I don't know what to do because I cannot wait until March or April, because then all these months are going by where I'm going to feel like crap. And if it indeed is not POTS, like he says it's not, then I lost all this time that it could have been finding other solutions or another diagnosis or whatever is wrong with me. I can't wait 7 months. It's going to be a whole year at that point by the time I'm finally dead. Over a year from when I've gotten really, really, really bad. I've been like this my whole life, but from when it's been like debilitatingly bad, it'll be like a year and a half. I don't know what to do. Oh my goodness, we have an update, guys. Oh my gosh, when was the last time I even updated you? I'm having an obligatory sushi. It's 9:30 in the morning right now. And I'm having sushi to celebrate my little wins. Guys, I drove over an hour to see a neurologist today at Penn State Hershey. We've had quite a long week. It has been so stressful. And I'm like, this appointment is not going to go in my favor. I'm really stressing out about it. Sorry, I got to pick all the cucumber out of here because I hate cucumber. So I'm picking cucumber out of my sushi while I talk to you. So I have an appointment here, and then I also have an appointment with a new cardiologist for a second opinion on everything. So you guys know I've not been heard. My other cardiologist just was gaslighting everything, was like, no, you don't have any of these problems. I've had migraines for pretty much my whole life, but I never got like an official diagnosis with neurology. It's always just been like, oh, we'll put you on these migraine meds, hopefully they help, blah, blah, blah. And that's just kind of how I thought it was supposed to go. I didn't realize I was supposed to see a neurologist for further migraine testing. Like, it was never something that was brought up. So I finally now have an official diagnosis of migraines, and I'm being put on medication for preventative and preventative, and then like if I end up getting one while I'm on the preventative. I've never been on a preventative one. The last medication I took was Furanol for my migraines, and that stopped working, and at that point my doctors were like, sorry, can't help you anymore. So I'm being put on rizatriptan. And that is when you get a migraine, you take one, and then 2 hours later you take another one if you stop the migraine. And I'm being put on amitriptyline. I don't know. That's the preventative. So I'm being put on that. And yeah. So anyway, that's not the biggest thing though. You guys know that now we've been fighting to try to get POTS testing or autonomic disease symptoms, testing, tilt table test and all that kind of stuff. And the cardiologist just totally blew it off. He's like, nope, you don't have it. Not at all. So I went back to my doctor. I sent all my symptoms in, and I did my own research. I called around like every doctor I possibly could within the state of Pennsylvania. And I called and I picked a doctor, a medical center who was like, yep, we can do those testings if we see that you need them. And that was pretty much it. Other ones were like, we don't do that. So I picked Penn State Hershey because they have a couple of doctors who work with POTS patients. And I went in and they looked at my symptoms, the videos that I have of my heart rate, all kinds of stuff. And they listened. They agree. They think I have POTS or other autonomic dysfunctions. So I am now being sent for a tilt table test
and a full autonomic dysfunction evaluation, as well as an MRI with and without contrast, just to make sure everything else is going on fine up there. So we are celebrating because finally somebody listened to my symptoms, and oh my gosh, it's gonna be weeks until I can have that testing done, but finally somebody listened. So I'll keep you guys updated. Oh my gosh, guys, it's so cold out here. It's finally turning into winter. I'm not happy about it, by the way. I'm not happy about it. Anyway, we're on to the next step of this journey. The last thing you guys saw was me going to the neurologist and finally them listening to me and wanting to evaluate me for POTS and other autonomic diseases and stuff. And they scheduled me for an autonomic testing, which is not until March. But they also scheduled me for an MRI with contrast for the migraines and everything else that's going on. So today, that's what we're doing. I also want to say, I'm really irritated because this video started out with me having like this armpit pain that goes down into my rib cage and stuff. And I still have that. I have that every single day. Everybody was sending me for like breast cancer screenings and all that stuff. You guys saw all of that. And then I was on TikTok, and the Institute of Human Anatomy posted this video where it shows like this clump of nerves like up in your armpit. And I was like, that's where I'm having pain. Like that's what hurts. Can they please let me know why? And they're saying, well, there's this clump of nerves here, and then those nerves branch out into your pectoral minor that goes down right where I'm having pain. And then they're like, there's actually a condition that affects these muscles called blah, 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 blah. And I'm like, thank you, TikTok, for diagnosing that problem that my entire team of doctors has been unable to do. I'm not sure what you do about it, though, so I'm going to have to look into that. But anyway, that was super interesting. So thank you to the Institute of Human Anatomy on TikTok and YouTube. Check them out because they're really cool. Only if you don't mind seeing cadaver dissections. That's what they do. It's like a training facility, and they use donated bodies for science, and they show you all the things that are happening in your body with these donated cadaver dissections, which is really, really cool. At least to me, I think it's really cool. So, all right, off to the MRI. Alrighty, guys, I am out of the MRI. It wasn't that bad. I know a lot of people say, like, ooh, that's horrible. Say about how horrible MRIs are and everything like that. To me, it's not that bad, but I'm not claustrophobic or anything. I was in the machine for about 25 minutes, and then they pulled me out and they did the dye contrast where they had to give me like an IV to do the dye, and they sent me back in for another 15 minutes, and now I'm here. So we have to wait a couple days for the results for that. Hopefully everything there is fine, because that would be a really crappy thing to have wrong up in my brain somewhere. But yeah. And other than that, I think the next thing I have for this is the autonomic testing, which is in March. Right now it is November 14th. So we've got a long way to go until the autonomic testing is done and we get answers for any of that. But I guess we'll see what comes of this MRI. I'll update you guys when I have the results. Wow, guys, I did not realize it has been like 3-4 months since I had that MRI. I was like, when was the last time I updated you guys? It's been a while. The MRI I had was on November 14th, 2023, and it is currently February 21st of 2024. I have been in this span of nothingness for that long, waiting for my autonomic tilt table test, which is happening now in 1 more week. 1 week and 1 day, actually. However, I am undergoing surgery as well now, which is a whole other thing. I don't know that I've updated you guys on all of that. I am now being scheduled for a total hysterectomy on April 10th, which probably by the time that surgery is coming out, we are going to have the results from the tilt table test. So either I will have already undergone the surgery, or I will be just undergoing the surgery by the time this year-long video hits you guys. So I am having a total hysterectomy for other reasons that are not pertaining to what this video now is pertaining to. Even though this video started with the OB, the issues that I'm having with the pain, which I still have, are most likely caused by flare-ups from postural orthostatic tachycardia syndrome. So I figured I'd update you guys because this is still a cardiology issue. I have to be, now that I'm going through all of this stuff with this video with the cardiologist and the neurologist and blah, 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 I do have to go for another EKG to be approved from my cardiologist and the neurologist that's dealing with the POTS issues in order to be approved for the hysterectomy. So it's kind of falling in the realm of both of my issues now that I'm having problems with. You guys will know about the hysterectomy portion of my life prior to knowing about this portion of my life. So sorry about that. The MRI came back fine. What were we checking for? Brain issues for my migraines. I don't even know anymore. The MRI I don't think was pertaining to the POTS. It was pertaining to my chronic migraines, which I got diagnosed with during all of this process. Anyway, the MRI was for the migraine portion of all of this. The MRI turned out totally fine, other than the fact that I have sinus problems, which I've known my whole life. I have had CAT scans and other things done of my sinuses, which my doctor at the time asked my parents, how are you still alive and how is she still breathing? Because my sinuses are so trashed. Well, apparently they're still that trashed. I am just shocked and blown away. I should have the surgery to put the balloons in my sinuses and all that stuff. Never done it. I probably should. Maybe that'll be another thing down the line. But as far as the POTS and the autonomic disorders and my migraines, the MRI was fine. It opens up a whole new can of worms later on for the sinuses. Not going to worry about that now. I've been living with that my whole life too. It is what it is. Anyway, we're going to go get an ECG done now so I can get approved for surgery now that I most likely have POTS and I have chronic migraines and I've got a hole in my heart and all of the other things going on in my life. So let's go get this EKG done now. And I'm sorry, I've been absent this whole time because since November until now, there has been nothing but silence other than this hysterectomy issue, which, like I said, is, go watch that video. I'll link it right here. Okay. Yeah, let's go.
Alrighty guys, today is the dreaded tilt table test. We've been waiting a year now to get to this point. I do want to say the echocardiogram from the previous video came back normal, just showing the possible enlarged left atrium, which we've already known. So it didn't show anything we didn't know, but it was enough to clear me for my surgery, which was April 10th. The last time I talked to you guys, they called me yesterday and they're like, hey, we can't do that day. And I was like, please don't delay this. Please don't delay this. We're gonna have to do it in March instead. Usually things get delayed, so that was unexpected. However, it's March 13th. So they called me and I had less than 2 weeks to prepare for this. So, woo. We're going to be doing that. So I'm going to be having the total hysterectomy on March 13th, which is a Wednesday. But that's, like I said before, totally unrelated to how this video started, different thing. But the surgery and the results of all of this probably are going to all kind of come out to you guys around the same time. So we're going to drive. We got like an 1.5-hour drive to get to the tilt table test. And we're going to go do that, and fingers crossed it works out well.
Okay guys, we're almost there. Okay, the tilt table test, not so bad. There's a lot of horror stories online about the tilt table test, so everybody makes it sound out to be like this really terrible, horrific thing. Was not bad in comparison to some of the other things I've had to go through. I've had my 3 kids with no epidural, no pain meds, and also induced, so that sucked. And it really did make me flare up really, really bad. And yeah, they did everything. We did the full autonomic testing. So I had like the sensors. I had like a really big mark that was left on my arm from the like sweat test. Everybody says it makes you feel like you're being stung by bees and stuff, and everybody complains about it. I didn't think it was that bad. It more felt like if you touch a really hot pot or pan and then like the next day you wake up and it still has that burning feeling. That's kind of what it felt like to me. I had one on my arm and I had one on my foot and I had one on my leg. So it lasted 5 minutes. Like, it wasn't anything unbearable. The person administering also said it kind of feels like getting a tattoo. I don't have any tattoos, so I don't know what that feels like to compare it. I didn't think it felt like a bee sting, though. It wasn't that bad. I did a couple of breathing tests as well. So one, I had to like breathe in, like there was a line that went up and went down. And when the line went up, I had to breathe in, and when it went down, I had to breathe out. So I had to like stay with the line, like that a couple of times, which started making me feel real tingly, real funky. I don't know what any of that is testing for. And then there was another one where you had to blow into this little device. It almost looked like a really big round fat inhaler. You had to like blow into it and blow hard enough that it started a timer. So there was some sort of force, I don't know what that force is, that you had to hit in order to start a timer. And then you had to like continue blowing out for an additional 15 seconds after that. That's not my strong point. Nope. I go scuba diving, I run marathons, I do all kinds of things, but that makes me lightheaded. So didn't go well. And then they did the tilt table test at the very end. So they laid me down for like 5 or 10 minutes and they took my blood pressure every minute for however long, 5 minutes or whatever. And then they sit you up and you're not straight up vertical. You're at a 70-degree angle, which let me tell you, that's weird. My muscles were like tensing up and doing all kinds of weird things, and it made me flare up bad. I don't know what my numbers were or anything like that. I couldn't see any of them. It would take your blood pressure every minute. And then I also had a cuff on my finger that was like taking my pulse. And yeah, every minute for like 10 minutes. And it felt so weird to be at a 70-degree angle because you weren't like standing straight up, but you like, I don't know. It was a very awkward angle, very uncomfortable to be in. And then after it took like my blood pressure or whatever, they would ask me how I'm feeling and all that stuff. And I said, like the first couple minutes, my vision gets kind of like, I can see, but my vision gets kind of like tingly. Kind of like you're looking at like the fuzzy TV screen when the TV screen doesn't like load like back in the day. Okay, if you're my age or older, when the TV channel doesn't load quite right and it's got that fuzzy, like that's kind of what my vision looks like for like a minute, and then it starts to get better. I start getting tingly like on the side of my arm here and like these, like my pointer and my ring and my pinky finger, like this whole thing starts getting tingly, and my feet and my legs start to hurt so bad, so bad. I feel like all my weight is like going down to my feet. That's kind of what it is. And then obviously like the lightheadedness and stuff like that. And then they lay you back down and everything goes back to normal. So I don't think it was that bad. I'll do a full video on the tilt table test later, my experience. Yeah, that's kind of where it's at.
It's here. I got the notification. That the results are in. Oh, I'm so scared to look at them though. What if that's not what it is and I gotta go through more testing? Okay. Breathe. This has been too long of a journey. It has been 224 days. 224 days from the very first video of this, almost a full year. I just got a message from the neurologist. It's a document, so they haven't called me, they haven't sent me like files with results or anything like that. But the document that I got a notification about in my portal says, please contact patient and let her know that the autonomic testing and tilt table test shows that the patient is positive for postural orthostatic tachycardia syndrome. It's like, it sucks to have a chronic illness, especially one like this where like you're just expected to pick your life up and keep going regardless of how awful you feel. Like there's no way to put into words what I feel like every single day of my life, or taking a shower is like right now is the only thing. Like if I take a shower in the morning, I can't do anything else. That's it. That's all I can do for the whole day. And having special needs children and homeschooling and having to be a mom and just everything, like doing the dishes, having to bend over to put dishes in the dishwasher is debilitating. And other people just, they don't understand that. They just don't. They don't understand how you feel or how your body having that tachycardic heart rate just from standing up can ruin your whole day, your hours, weeks. Things like that can just, it just ruins things. Like chronically exhausted because your heart is working so hard just to get blood back up to it and up to your brain. So it's like, it sucks knowing that like that is what it is, but it is such a relief to know that I have the answers to why I feel like this. I can get treatment to make things better. I don't know what those treatment plans are going to be. I'll talk about those in the future. And just like that I'm not crazy. You know, there's a lot of times where, well, like the first cardiologist that I saw back in September just basically labeled me as crazy because his understanding of POTS was not right. Even though he was a doctor, his understanding of this chronic illness was inaccurate. And that costed me an extra 5 months of suffering. And it shouldn't have been like that. I sent him the information about POTS and what it is, and I educated him on it according to the national standards. And he didn't want to hear it. So the medical gaslighting and the doctors who aren't willing to listen and help caused a lot of problems in this, obviously. But now we're here. We got the diagnosis. We're going to keep moving forward. I do have to make an appointment with the neurologist. I do have an appointment with the new cardiologist that specializes in POTS. However, they are booked out until September, so I can't see the cardiologist that will be able to treat me until September. I don't know about the neurologist. We'll see when I can get in for that. It could be forever. The new cardiologist or the neurologist might not be able to see me until September either. I am not sure when I'll be able to be seen for that. But we have the diagnosis, and that is the first step. And technically, after 224 days, that's the first piece to feeling better. So now we're through that, and that is going to end this chaos. I am going to make a lot more videos about this, about all the different like tests that I had to go through, the tilt table test, all of that stuff, what's going on moving forward, my hysterectomy going forward, if the hysterectomy helps with the POTS symptoms, all of the stuff, migraines, everything. So if you're interested in any of that, please hit that subscribe button, follow along, give the video a thumbs up. Thank you guys so much for sticking with me through this hour-long video. I'll see you guys in the next one. Bye, guys.